Not all health problems are necessarily inherited. There are other reasons for those. It can be dietary, it can be environmental, it can be a combination of those factors. Genetic diseases, there's lots of them. There's lots of them in lots of different species, not just dogs. They're in humans, they're in so many different species. Not all diseases are genetic, and a fair few still have to be proven to be genetic. You can have genetic and environmental factors, so they can be quite complex reasons for why certain diseases occur. Things like hip dysplasia, they're considered multifactorial because you've got environmental issues, weight issues, rate of growth, and inherited issues as well, so an inherited weakness, shall we say. So some of these multifactorial diseases have not been sorted out to the point that you can say there's a nice genetic test to say, I've tested it, I've controlled it. It doesn't happen. Some breeds are more predisposed to health problems, but it varies per breed. Again, giant breeds are probably more prone to bone disorders because they're big, heavy breeds. They grow rapidly, so you're going to have things like hip dysplasia, elbow dysplasia. You might have, as they get older, things like cardiomyopathy. So these are associated more with size. So with the smaller breeds, you might have knee issues, as in slipping patellas, that type of thing, and probably less problem with, say, hip dysplasia. You do have other problems with certain types of breeds, like the brachycephalic breeds, where they've got a shorter head. They may have breathing issues occasionally, but not all shorter-headed dogs have these problems. And again, a lot of them middle-range breeds, dogs that are out there hunting breeds that go swimming, they don't necessarily have those, but they may have their own associated problems. Well, any genetic problem is by its origin. If the word you're saying it's a genetic problem, then it's inherited. Okay, and it means the means of inheritance can vary as well. You can have a dominant disease, in other words, the gene is dominant. It only requires one parent to throw that gene and the animal will be affected. You can have a recessive gene. The vast majority of genetic problems are recessive, so that you're getting a carrier parents. They both throw that gene and then the dog may be affected. So these are the ones that are more readily testable for, and these are the ones that most people are testing for, like eye diseases, PRA. Single factor problems are generally where you get a nice DNA test for. Where there's a proven test, okay, and it's got to be proven test for that breed, we call it a breed-specific test. What you can do is then breed away from a problem by testing the parents, okay? The important thing about having a breed-specific test is that you can then select parents so that you do not produce any more affected dogs. You can still breed with carriers and you put them to clear dogs, okay? So you're not wasting part of the population. Within certain breeds there are well-known testing programs. German Shepherds, for instance, we have hip and elbow schemes. We've managed to bring the breed average from around 22, it's now under 10. Moved the elbow scheme from around 30% of the breed having it to now less than 5. So these are things that take time. They take time to bring the whole breed, like the whole of the country has to come down for it to be effective. But it's now so effective that we're doing really, really well. Where we've got what's called a litter registration limitation in place, LRL, that means all parents of that breed have to be pre-tested for things like hip and elbows. There are some DNA tests that are in there as well. But all the time, different breed clubs have different diseases they recommend that are there tested for prior to breeding. Breed standard is basically what was agreed upon by breeders early on in the pace to say these are the characteristics of this breed, and some of these are unique. One, for instance, say like the French Bulldog, they have bat ears, these rounded ears, which are unique to the breed. Some of these features are unique. A German Shepherd, they have ears that are up and they've got a little point to them. Certain characteristics are there, and you then want certain height to length proportions, length of leg, depth of chest, certain coat types. It's an outline of the breed, but these are kind of living documents. They are changed over time. We keep on trying to change it so that we keep on improving health at the same time. Breed standards are regularly reviewed. In England, I think they've got some sort of system now, they review them. It's a bit like reviewing a law act. You do it every 5 years or so. Where we consider there's a problem, I have been pushing from the canine health and wellbeing point of view. As judges, we try and make sure we avoid exaggerations, and this is worldwide. They're trying to avoid exaggerations, like excessive wrinkling of the coat, in things like the Shar-Pei and things like rolling of the lids, entropion. That if you see those, that you avoid them. An irresponsible breeder to me is a person that breeds without knowing A, the pedigree of the dog. Quite a lot of these backyard breeders that are breeding the oodles and poodles, they have no pedigrees behind them. They don't know who's related to who. And they keep on breeding them. And both parent breeds have eye issues. Both parent breeds quite often have knee issues. So you will over time, and some of them have heart issues, you will over time start to pick up both problems. So to me, a responsible breeder is one who knows what diseases they should test for. And then they should test and they should breed within normal limits. So there's no point of testing and saying my dog's got a hip score of 64 when the breed average is 10, and then they breed with it. I think that is irresponsible. If you want to avoid irresponsible breeders, I think the best way to go is to contact the club, find out what health testing they recommend, find out what they recommend is within normal limits, you know, what is acceptable, and then find out what certificates the parents of the puppies have. In the case of French Bulldogs, we actually even screen the puppies to make sure we don't have any major back issues prior to them going to their new homes. A lot of breeders can be inexperienced, and they can, through ignorance, not know of some of these tests. And I think it's up to veterinarians to let them know that these tests should be run on certain breeds. And the more that we go into these, little designer breeds, I think the more we have to start saying, do you know the parentage of these dogs? Do you know the history of the breeds behind them? And do you know that these sort of issues are probably going to pop up? I mean, little mongrels down the street, we're not even pretending to be, say, a designer breed. They are prone to problems as well. One of the most common is bad knees. Sometimes you have vision issues, heart issues. So they're as prone to health issues as are humans. Every human is thought to have at least 7 genetic defects. You don't know about them, and they may or may not show up, but we have them.